My name is Zvi Small. I'm a board-certified plastic surgeon. I've been practicing plastic surgery in Bergen County for 20 years. Breast augmentation is a procedure performed to increase the volume of the breasts. Typically, patients who are born with congenitally small breasts or women who may have nursed and have deflation of the breasts after having their children would typically benefit from this procedure. The best option for people seeking breast augmentation is augmenting the patient's breast with an implant. We either use saline-filled implants or silicone gel-filled implants. 85% of the time we use silicone gel-filled implant because it offers a more natural looking and more natural feeling result as opposed to a saline implant. A breast augmentation procedure is right for a patient when a patient doesn't feel good about the size of her breasts, whether it's someone who was just born with small breasts, someone who was born with significant asymmetries between the two breasts, or for maybe someone who already had their children and nursed and has a deflated appearance to her breasts. A breast augmentation procedure with an implant entails traditionally and typically a small incision about 3 centimeters wide in what's called the inframammary fold, the breast fold underneath the breast. We use that incision and traditionally we lift up the lower portion of the pectoralis muscle and place the implant inside. We use several different sizers to make sure we get the best fit before putting in the final implant. While the patient's asleep, we also numb the chest up. We anesthetize the chest with a medication that lasts 3 days, so the patients are traditionally very comfortable when they wake up. There's different thought processes involved in where you put the implant, above the muscle or underneath the muscle, and that depends on the patient's anatomy and goals. Leading up to the day of surgery, we have a very close communication with the patient, what her ultimate goals are. And I find the best way to communicate that is to look at pictures together. I'm always surprised at what patients think is too big or too small. The best way to look at that is not use subjective words, I want to be bigger, I want to be smaller, but to look at actually photographs of people who are similarly framed to her and what we can achieve. On the day of surgery, with that in mind, we then go into the operating room, make a small 3 or 4 centimeter incision in the inframammary fold. That's the fold underneath the breast, and lift up the pectoralis muscle and place the implant in. If the patient has certain characteristics, occasionally we'll place the implant above the muscle. It all depends on what the patient brings to the consultation and the table and what their ultimate goals are. Patients can expect to see their breasts larger after surgery without significant discomfort because we anesthetize their entire chest. So the results are instantaneous and typically very gratifying.